While Kelly is pulling that up, I'll just share. If people have questions during, I'll keep an eye on the chat, or if you want to raise your hand and I can let Kelly know since it will be hard for her to see the group while she's also looking at her screen.
Let's see. I was attempting to use a different share view. It said like side by side, but I still can't see any of you. So um, feel free to hop in and ask questions at any point. Um, come on.
You are still side by side though. It's like we're seeing you and your screen.
Okay,
So
interesting. So
I got two of you on my screen.
that is not the way I wanted to share it.
I didn't think so, but I figured I'd tell you.
I thought that would be my view, not your view. Okay, let me try this again. Sorry about that. Content only. Okay. How's that? Are you just seeing the slides now?
Yes,
Yes.
that's good.
Okay, great. Thank you. Okay, so thank you for having us today here to talk about fueling success by building America's healthiest schools. We're really excited to talk to you today. I know that you've been to a couple of the previous webinars in this series, but we are MaineHealth Partners Help for Healthier Communities, working as part of the Maine Prevention Network. So with guidance from the Maine CDC, we work to create positive public health changes in our communities using evidence-based strategies. So you know our tobacco prevention team, and then our healthy eating active living team is myself, Casey, and Alexa that are here today. And we also have substance use prevention and youth engagement empowerment work that we do. And here we are. I know we just introduced ourselves for Lisa and Heather. I know you both know me and you know that I support your schools and your school districts. So, but there is the breakdown if you're curious who covers what school districts. And so we want to talk to you today about why do healthy schools matter? So we know that schools function best when students and educators are happy and healthy. So we know that you're here today because you care about your school community. You know, you're already implementing many practices to support the health and well-being of students, staff, and families. You've demonstrated this with your work you're doing in partnership with our tobacco prevention team, Alyssa, Regan, and Chelsea. So whether that's implementing evidence-based tobacco prevention curriculum, attending these webinar opportunities, or just communicating with students about healthy habits. We know you've worked hard to prioritize the health needs of your students, staff, and families. And these efforts are what could earn you recognition as one of America's healthiest schools. So to go over what is America's healthiest school. So this is by Alliance for a Healthier Generation. America's Healthiest Schools is one of the nation's longest running recognition programs. It honors schools for the key role they play in advancing the health and well-being of the entire learning community. So awardees each year will earn a spot on the annual list of America's Healthiest Schools. Any K through 12 public school is eligible to apply for recognition, which celebrates schools that implement evidence-based practices to support the physical, mental, and social emotional health needs of students, staff, and families. So schools and their team may apply for recognition in up to 9 topic areas. So why apply? So you earn your spot on the national recognition list. And then your school will also receive a digital promotional package to help share your accomplishments with your school community. So basically, they provide you the stuff to shout it from the rooftops and share the news that you were recognized. So schools may apply for recognition in up to 9 topic areas. Um, and awardees must meet specific criteria within each category, each topic area that you wish to apply for. To achieve recognition, all the criteria in a single topic must be fully in place during the 25-26 school year before the submission deadline. Submission deadline is in April. So when the award application opens after it's open sometime in January, your teams will you can enter information about your implementation method improvements made during the school year or procedures or communication sent to students and families. So I'm going to go into each of the topic areas and just kind of briefly touch on each of those. So the first one is supporting school health services. This recognizes school teams that routinely conduct health screenings, address chronic health conditions, and provide a pathway for students with health concerns to receive additional support from the school or community-based providers. Implementing local school wellness policy. So this recognizes school teams that implement the district wellness policy with the support of a diverse set of representatives, set measurable goals, and reflect on progress, successes, and challenges. Improving nutrition and food access. Recognizes school teams that implement strategies to maximize school meal participation, meaningfully collaborate with teachers on nutrition education, and partner with community organizations to improve families' nutrition security. Bolstering physical education and activity. Recognizes school teams that provide physical education using an evidence-based curriculum and integrate physical activity opportunities throughout the school day with all students, including students with special health needs. Enriching health education recognizes school teams that provide health education to all students using an evidence-based curriculum and prioritize opportunities for students to practice skills to maintain and improve their health. And then we have strengthening social emotional health and learning. Recognizes school teams that positively motivate participation in learning, implement an evidence-based social emotional learning curriculum, and provide opportunities for students to regulate their emotions and learn from their mistakes. And then we have promoting tobacco-free schools. Recognizes school teams that address tobacco use in youth through prevention education, actively engage students in promoting a tobacco-free campus, and provide support and cessation intervention when students vape or use tobacco products. Whoops, I forgot to change my slide. That one, and then next one is cultivating staff well-being. Recognizes school teams that provide resources to support breaks for all staff during the instructional day, actively promote staff relationship building, and foster a culture of gratitude among colleagues. And then finally, the last topic area is increasing family and community engagement. Recognizes school teams that gather input from the school community, engage parents and caregivers in meaningful ways to support student success, and connect families to resources related to social drivers of health. And it's also I want to note that schools that do choose to apply for recognition and receive recognition in all 9 topic areas will be honored as all-star schools. So it's the highest level of achievement in the America's Healthiest Schools program. So that being said, schools can choose to focus on 1 category and apply, or 2, or up to all 9. So just wanted to go over some tools that help get you there. So looking at the list of 9 categories, I know can seem daunting and overwhelming, but there are some tools here, and I'm going to break it down a little bit to kind of show you the action steps you can take to work towards this. So first off is the America's Healthier Generation Action Center. So it's here you'll create an account and you will the Action Center will give you access to tools and guidance to create healthier environments. And it's also where the application for recognition will be completed. The Action Center contains various assessments, such as the Thriving Schools Integrated Assessment, which the recognition program is based off of. There is a library of resources for families. There are curriculum available, training opportunities, and you have the ability to set goals or priorities within the Action Center for your school team to work on. So this is, once you log in, this is what your dashboard will look like. So this is a screenshot of my dashboard when I log in. So you can see here on the left, there's a tab for resources and trainings, which you can search by topic area. There's various resources such as websites, videos, one-pagers. There's curriculum, like complete lesson plans, lots of great stuff in the resources and trainings. And you can save them into your favorites to have easy access. Here, there's Alliance for a Healthier Generation has some upcoming live webinars, so that's listed right at the top. And then, so when you register, you will connect yourself as a school team member to access the different assessments and the award application. So as you can see on my screen here, I'm connected to all the schools in the areas that I serve in York County. So you can see Biddeford here, but like when I scroll down, I'll also see Kennebunk and Noble and York. So I can go into the various schools, but you'll connect it so that'll show up right here for you, and you'll have access to your schools in your district. And then the next thing that I find really helpful is their help with the Action Center. It's kind of like their help page. So it's at healthiergeneration.org/help. And they have all these short videos that walk you through how to create your account, how to log in, how to find your organization. So like connecting to your specific school, how to complete an assessment using reports. So there's a ton of different tutorials here. In the Action Center, there's also a policy builder capability. So there's a tobacco one, and I believe there's a basic wellness committee, wellness policy that you can utilize the tool to build the policy. So there's some tutorials here. And then I wanted to bring up this is the award guide for this year for America's Healthiest Schools. So this is a separate PDF, and I think I'm going to stop sharing and then reshare on the PDF because I don't think it'll just switch over. But this kind of dives into each of the topic areas and what the criteria are in each topic area. So before I share this screen, any questions at this point, or ready to check out that guide? Okay. Oops. Sorry, I shared the wrong thing again. Here it is. Okay. So this is the actual award guide. So this really kind of summarizes the whole entire process. talks about the topic areas, some submission deadlines. So as long as you're implementing any of these strategies listed in these topic areas by the end of, by April 14th, you're able to apply for recognition. The application will open in January and it closes April 14th. There's no cost to apply. And then, so this is kind of where I wanted to dig in. So here are the award, the topic areas. The descriptions is what I read in my each of the slides. And then there's going to be criteria listed for each of these categories. So for right now, let's jump to the promoting tobacco-free schools, because I know you're all doing this work and you've been attending these webinars and working with our tobacco team. So I figured we would start here and use this one as the first example of, so schools provide tobacco product education. That is the first criteria. So our district's school-based tobacco product education was provided at least once this school year to all K through 12 students and included age-appropriate, culturally responsive direct instruction on skills to enable students to avoid tobacco product use. So the required evidence that when you apply, they will ask you to upload the vaping prevention material or curriculum name used with each grade. So for example, if you're using Catch My Breath, which I know our team uses and does trainings in, that would meet that criteria right there. And so right here, they give you examples of strong responses. So when you're filling out your application, these are some strong responses. So saying the full name of the tobacco and vaping prevention curriculum or material used with each grade, description of how age-appropriate lessons are delivered across the grade level, whether it's integrated into health or science classes, or if it's through assemblies or part of Red Ribbon Week activities. And then if multiple programs are used, clarification of which curriculum or materials are used with each grade level and how they're integrated. So these are just some tips they give you on how to create a strong application. So then, describing how many lessons, and upload at least one tobacco and vaping prevention education material or lesson plan. So it goes through this, the different requirements, and it's when you do the application, it'll have you upload the things in each. So for this one, student engagement and the district tobacco-free policy, they would want you to select at least 2 student engagement methods used to implement and improve the district tobacco-free policy that were student-centered and developmentally appropriate. And it gives you all these options. So this is just kind of an example of how to look at the criteria and what you will need to upload or answer in order to be fully implementing everything in that topic area. So it goes through every category and lists all that stuff for each of the topic areas. And at the very end, I think there's just some type of glossary. So I'm going to stop right there, go back to my slideshow. Okay. So, yeah, the award guide will really help you kind of understand the requirements to earn the recognition, with questions to help verify your implementation. Um, and then, like I said, the suggestions for the strong responses with examples of what the reviewers will look for, example files to guide you in demonstrating implementation. So that can all be found, which in the guide, which we will provide you with. Yes, Regan.
I have a quick question, and if you're going to get to this, just tell me you're going to get to this too. But do when so if one of these schools was implementing the tobacco portion only, let's say, um, and they applied, is there opportunity for them to be recognized? I know at the beginning I heard you say like you could
Yes.
just be doing one piece of all this. Okay, so there
Correct.
isn't like a certain number of different things that they need to do in different categories to get recognized. Essentially, if they are like I can think of a lot of schools that are, doing the tobacco portion at least, right? And so if so, they could be recognized.
Yes, so you can apply for one category. So if it's just tobacco prevention, as long as you're meeting each of the criteria under the tobacco section, you can apply for recognition in that category, and then you will be listed or recognized as one of America's healthiest schools. Yes. You can apply for more than one topic. Um, and if you do all nine, which I know is very ambitious, especially if it's your first time, you will receive the all-star recognition. Yes, Alyssa?
I was just thinking about, so it looked like as we went through the criteria, for just the tobacco section, it was talking about providing like tobacco education, for lack of a better word, to grades K through 12. I'm wondering, like, because folks apply by school, like for example, could middle school of the Kennebunk submit, and even if they're not providing education at that younger level because they don't have that grade at their school, like how does that work?
Yeah, I believe, so you are applying specifically by school, not as a district. So, like, if Lisa were to apply, she's going to talk about grades 6, 7, and 8 for that school because that's what's in that school. So, um,
So
you
that
know,
still counts even if
yes,
the younger grades are not, and I
I
don't know
believe
any of that.
so. I may have to check on that, but I believe you're answering just for your specific school. Yeah.
Okay, thanks.
Yes, Lisa?
So as an example, so I do catch my breath. And if this had been a different year, I would have done it for all three grades because the first year I implemented it, I made sure everybody got that basic introduction. I would have to say sixth grade, seventh grade, and eighth grade would be getting it.
Let's pull up that guide again to read.
Because we do it at the middle school level. We talk about drugs in eighth grade, but we actually do catch my breath just in sixth grade. I know that they have a seventh and eighth grade curriculum.
Okay. Where are we?
It was like yeah, I think number one, and then referring to that
Yeah.
outer districts thing. So it looks like it
So,
says was
I
provided at least
believe
once this school year to K through 12.
I believe that so this mentions educational material or curriculum. So, I believe it would be acceptable if you're just providing maybe you're not doing a full curriculum with a certain grade, but if you are providing some educational materials to them.
Like, for example, Red Ribbon Week, right?
Yeah, yep. So that is one of the things that they mentioned here. Age appropriate lessons are delivered across grade levels. It could be integrated into a science class or health class. It could be through an assembly or part of Red Ribbon Week activities. So I think, just having, one little session where you're talking about it really is also acceptable. It doesn't have to be like a full curriculum.
Right.
That's great.
Okay.
So as long as there's some type of lesson.
Mhm.
And I would just also point out, just because I want to be respectful, that Heather's here too and may not know what's happening in I shouldn't assume that, Heather, you don't know what's happening in the health class, but I do know that Stephanie was implementing the Catch My Breath curriculum as well. So at the high school level. So I know that's happening at Biddeford High School also.
And one thing I'll mention is, so I know in Kennebunk, I've been attending, Alyssa and I both attend their district wellness or wellness committee meetings. And I've presented this in that to that committee, and the superintendent is committing to apply. Still, they're still determining which categories, but we know right now for sure 100% they're doing the nutrition. Trying to find it. Improving nutrition and food access. So that was their number one, like right off the bat. They knew they were going to do at least that one, working with the school nutrition director. And it has a lot to do with school meals and different strategies related to participating in school meals, and then nutrition education and food access, which Heather, I would think that Biddeford would be right in alignment with this as well. I mean, I know all of our school nutrition programs in York County are doing amazing things. So I think really it's like just connecting with the right people who know what's happening in each of the categories. So let me continue with my presentation and I'll kind of get to like some next steps. And then I wanted to show you this. So within the Action Center, there's a tool called the America's Healthiest Schools Readiness Tool. So this tool is like kind of like a pre-application you can do, just pre-assessment to see if you're ready to apply in any of the categories. This is a short 3-minute video tour that they have provided in the Action Center. And I just wanted to show you this. So it demonstrates like how you can click on all the different requirements and then determine if you're eligible to apply. So you should be able to hear the audio. If you cannot, just let me know or raise your hand.
America's Healthiest Schools is Alliance for a Healthier Generation's prestigious annual recognition program, honoring schools for the key role that they play in advancing the health and well-being of the entire learning community. Start preparing today to be one of America's Healthiest Schools by completing the award eligibility checklist. Find the checklist by logging into your Action Center account, then click on View to the right of the checklist or on the left side navigation. The checklist is one of our assessment tools. Any K-12 school in the United States is eligible to apply. School teams may apply for recognition in one topic, more than one topic, or all 9 topic areas. Each school team member can answer questions with their own account. At your next leadership team or wellness committee meeting, answer and review your progress towards a healthier school environment. Start by clicking on a topic area, then the question. This team selected mostly in place because there are times each week when there is no qualified staff available to dispense student medications. This school is not ready to apply for recognition in supporting school health services this year. The checklist also helps your team know which practices are not fully in place yet and could be improved in the future, setting your school team up to apply in more topics for national recognition. After you answer a question, click Save and Next. Please note that if you answer a question on the checklist, it will show as answered in the Thriving Schools Integrated Assessment. And if you have already answered the same question in another assessment, it will appear answered in this checklist. For this best practice, the school nurse updated their written referral pathway for students with health concerns with additional community-based healthcare providers. So this practice is now fully in place. Because this question is an award criteria, when fully in place is selected, information will appear below. You will see what documentation to provide in the application to verify this practice has been fully implemented during the current school year. Make sure to click Save after answering each question. To receive an award, all criteria in a single topic must be fully in place during the current school year before the submission deadline. This school is ready to apply in 3 topic areas: improving nutrition and food access, strengthening social emotional health, and promoting tobacco-free schools. As a reminder, this award eligibility checklist is not the application. If you decide to apply for an award in 1 or more topic areas, get a head start by using the award guide here. Your school team can start gathering the required evidence in a shared folder and enter notes in the award guide. This downloadable guide will answer your questions. You can also visit the award homepage for up-to-date information. By using the checklist, you will know which topic areas to apply for and have gathered the documentation to provide when the award application opens in the Action Center. Please contact us with any questions or for technical support. We look forward to working with your school team as you apply to be one of America's healthiest schools.
All right. So how to apply. So using that tool, you can determine which categories you have all the criteria fully in place. And the other really great thing about the Action Center is, so say you're really close in one topic area, but you're missing one component of it. You're able to use the Action Center to kind of set that as a goal. And, you can look for tools and resources to help you with implementing it fully, whatever it may be. And then once you are implementing it, then you will be ready to apply in that category. So using the award guide that I showed you before, you can gather the documentation and then you would submit the application, which is in the Action Center, which is kind of similar to that checklist we just looked at, but it's the actual application. So there is an application overview in here. I probably won't get into that because it was very redundant of the checklist video. It was very similar. But this video is in the app or in the Action Center if you would like to watch it as time gets closer and you're getting ready to apply. Whoops. No. Okay. Really, so the next steps, I would recommend creating your account in the Action Center. And then So you'll register and then you're going to link to your school. So there'll be a spot in there where you can just search for your school and it will pop up. And then, taking it back to your school and identifying a school team. So I know in Kennebunk, the wellness committee has been kind of looking at this, and then the representatives on the wellness committee from each school are taking it back to their schools to kind of go over with their teams and look over the award guide and just kind of get a sense for what topic areas that they're maybe close or ready to apply for. I think it seems a little daunting and overwhelming with all the categories and criteria, but I think really if you look over it with the correct people that are, implementing the different strategies, that you'll find that your schools are already doing a lot of these things. And you can probably, I would guess you're probably ready to already apply in a couple categories and you haven't even had to won't even have to make any changes. And I bet there are certain topic areas that you're really close. And if you just do one more thing, you'll be able to apply in that category. So really taking it back to your schools and your team and just kind of looking at those categories and seeing, kind of figuring out where you're at and what categories you may be interested in applying for. And then working together to do the readiness tool, and really getting a grasp on what's needed to upload. And then you can apply in one or more categories by April 14th. And so the timeline, the application is due April 14th, and then the awardees will be notified in over the summer of which schools received the recognition. So as long as you, if you apply and are, they go through the review process to verify everything that you've submitted. But as long as you earn recognition in one topic area, you receive the recognition as one of America's Healthiest Schools. So I wanted to point out that Alliance for a Healthier Generation does have an upcoming webinar on January 28th. So I screenshotted this right from my Action Center, my dashboard. It was right at the top there. So they're doing a webinar on how to make the list of America's Healthiest Schools. It's probably going to be a lot of what I went over today, but if you are wanting to learn more or dig deeper or ask them questions, I recommend attending this webinar because, it's their recognition program. They're the experts and you'll probably take away something from there that I didn't mention today, I would think. So that is available. And then I also wanted to, again, reiterate. So our team, our HEAL team is really focused on trying to work with our schools to help them apply. Currently, there are no schools in Maine that have been recognized. So we hope to change that for this year, and we would love to see a strong representation of York County schools because we know how many amazing things you're all doing. And if all it takes is doing the application and uploading the stuff, like we are here to help and provide assistance in any way that we can. And with that, let me stop sharing so I can see you and then we can chat and if you have any questions.
Kelly, can I just ask a question? It's a little bit more of like big picture because as you were talking, I'm a hands-on learner. So I went and made my account and logged into the account and started doing all the things. I guess I'm just wondering because it feels like this resource is providing a lot of information or helpful tools beyond just applying for this award, like that's all well and good, and I can do it, and we can do it, and we can be like patted on the back. But I think I'm more interested in like the cool thing about doing this process and doing the application. It reminds me of like NEASC, and I don't know how much like the MaineHealth folks know about like NEASC, like that's who accredits our schools, and we're like doing a self-study on our school and evaluating all of the elements of everything. And what's cool is then like we get to develop like an action plan based off of where we fall short. I guess my wondering is, have you ever um like done almost like an action plan based off of self-reflection, like if the crew and I kind of go through this and do this application, but we're noticing like, oh, we could get better here and we could get better here based on like all of these points that are sort of the standard for the healthiest school. I feel like we would want to turn that into something actionable for like the
Yeah.
next 2 to 3 years. Is that something that we could do, or that you do, or I don't know, maybe
Yeah,
that's a lot, but
absolutely.
that's where my brain went.
Well, no, that's so that's similar to what I was saying about the action center. So when you're in there, you'll have these assessments that you can do. So the recognition program is based on the what did they call it? Thriving schools, particular assessment. So you can go through that assessment tool, or you can just look at the readiness tool. You could do both or one or the other because they're linked to each other. So if you go through the Thriving Schools assessment and you answer all the questions, it's going to populate your answers over into the readiness tool and say fully in place. So they speak to each other. And then from there, if you see in one topic area, like, oh, I'm implementing this and this and this, but we're not doing this thing, but that's all we need to do to be recognized. So you can set that as an actionable goal in your action center, and create like a goal planning, basically action steps, to make that happen. And there's a lot of tools within the action center and resources that, can help. And they have, actually, they've been doing specific webinars on each specific topic area as well. So one whole hour dedicated to one topic area, and they really dive in. So those are all within the Action Center as well if you don't get to see them live. But yeah, the Action Center is a really great place to do those assessments, pick and choose what goals you want to work on, and then you can set them as your goals right within that platform.
And you think that would be like, I guess I'm just trying to imagine it like with a group of students. Like for me, that's cool, but like do the students have access to the, like, will they, I mean, I think I did when I logged in, I had to click like I'm a staff member. Like if they wanted to make logins, they could make logins and join it and see all the same things that I'm seeing, or no?
I think there is, so I think there's different access levels that you can give to people. I will have to check on how that works, but I believe so. I already am connected to all of my schools, even the schools that have never used it. I'm like the only one in there. But I requested access, and I'm in there as like I can't remember if I'm called a team member or what it is, but there's a way you like people can have access to the full everything, and then some people can have access to just certain aspects of it, like if they're a community partner or a volunteer. I know that's possible. I haven't really dove into that yet, but yes. So Casey and I were just talking, me, Casey, and Alexa were just talking about your student group in Biddeford, and we knew you were going to be on the call today. So we were like, wow, how cool would that be if she worked with her student group on some of this stuff? So yeah, that was kind of on our radar too. So I would love to definitely connect and figure that out, because, student voice is like, that's huge, right?
Well, right, right. And I want them like that they've gotten kind of like that's how they stay connected, is they feel empowered that they're like doing something. And so if if they can log in and they can be seeing all of this stuff, awesome. I think that's I was trying to process like how do I take what it's giving me and put it on like a Google Doc that is shared with
Yeah.
all of us that we can all work on. Do you know what I'm saying? Because like if they can't
Yeah.
log in and see the stuff, then like that's a lot harder for them to get excited about if they're not like a part of the work. Even if they're sitting around a table with me, it's cooler when they can like be a part of whatever it is like on a doc.
Hands on. Yeah.
Yeah. Yeah.
Hands on for sure. Yeah, for sure. I would love to help with that and figure out the best way to do that. I'm sure we can make that happen. Any other questions or thoughts? Lisa, I'm curious, at the middle school, who else might you connect with? Like what other staff members might you connect with on some of these topic areas?
Yeah, I had actually written down some ideas. So we don't have a school-based wellness committee. I think before I came, like far in the past, they did have something like that. But yeah, like immediately thought, obviously, an administrator, our student resource officer, the nurse, the phys ed teachers, a student rep. Um, and that was just like off the top of my head when I was sort of writing down, well, if I proposed developing a wellness committee, when could we do this? PTG, our parent teacher group, to make sure that, we have an adult that isn't a staff member in there. So yeah, I think those would be the ones. I even thought of when we could meet because meeting after school is so difficult for people. Kids have their activities, parents are, the kids are home by then. So we do late start Wednesdays,
Mhm.
every Wednesday, not the first Wednesday of the school year and not the last Wednesday of the school year. And the first Wednesday of the month, we actually meet as a department, which currently would be two gym teachers and myself. So big meeting. So being able to pull maybe the SRO, like, maybe 3 times a year, something like that, maybe 4 times a year. It would be just adding an administrator, the SRO, maybe somebody from the parent teacher group. If we could get a student in, I know the buses don't drop them off, but maybe it's the child of someone who's in the PTG and they can just come together. So yeah, I have been thinking of a few different renditions of how we could do this.
Yeah, that's great. And I'm happy to participate if you want to invite me. I'm happy to come and join whenever.
Yeah.
Go ahead, Alyssa.
Yeah, I can join too if you want me. Um, I'm just thinking about a little bit about like how, schools and administrators have a lot of competing priorities and a lot of asks from probably staff and community members and partners, and exploring ways that maybe we could help sell this to them, like perhaps perhaps maybe the MaineHealth team, like our group, could offer to, write up some press releases and, get those out if they're awarded, or maybe plan some type of um, celebration or things like that. I think that maybe brainstorming some incentives, for lack of a better word. I mean, being awarded one of America's healthiest schools, I think is an incentive, but I also think it's like, um, maybe for people who haven't heard of Alliance for Healthier Generations, it's like, oh, okay, it's like, it's another award we could apply for. But I think if we can really make it feel worth their while, like a press release about how they're one of or the only school in Maine that was awarded this year, and their collaboration and partnership with MaineHealth, and really like highlighting to the public like the effort and the effort and prioritization of health that was needed for these schools to be recognized, and then like also their partnership with us, and like I just think there's a lot. I think there's more that we could do to elevate and promote that to the community and shine some light on schools that apply. Aside from just that award, like how can we work to celebrate and promote that so that it really seems worthwhile for these schools? For some reason, I can't hear you, Kelly. I don't know if other people can.
Can you guys hear me? No.
No, now we can.
Can you hear me now? Okay. That's weird. I don't know what happened.
It's a little faint, but
Okay. Yeah, I love your point there, Alyssa, and all great ideas to think about for sure.
I too would just echo the idea of the involving the youth group. I know when Heather, when I saw that you were registered, I was excited too, and I'm glad that the HEAL team was thinking similarly about how we can support that. So I would also be happy to be part of those conversations to think about how we could engage the youth in the application, even if we have to sort of like we complete the application, but we do it in a unique way for the youth to do it their own way, right? So like I'd be happy to have conversations with in collaboration with the HEAL team and you, Heather, and the group to think about how we could support those efforts too, for sure. I love the idea of involving the youth group. And then to Alyssa's point, like I think our team at MaineHealth can think, and we've talked a little bit about this at some of our team meetings, but we do have a community meeting every year. And so, is there opportunity to give recognition there too, in addition to the recognition that schools could get. So I think we should be thinking as a team internally around this work, and I'm sure the HEAL team's already doing that.
For sure.
Yeah, I think, can you guys hear me? My computer does that weird thing too. But I would say certainly those of you on the call who are thinking about completing the application in one or more of the areas to keep us in the loop so that we can be as supportive as we can through the process, but also so that we know after you've submitted that, like if you're a recipient, and then we can, like be helping to promote that in the press if that's what you want, or
We want to
like,
brag about you.
yeah, totally.
We want
And
to
so
brag.
that like, we know in advance, like if we are going to maybe plan a small celebration, that's not just like, oh, like the award came in today and we're like, oh, we didn't know you applied. So, if you are going to do it, we'd love to be in the loop for all of those reasons. But if you don't want us in the loop, we understand.
I'll be sure to keep Kelly in the loop. I mean, because she's been coming to our meetings at least a couple times a year, and so she'll know all about what we're doing.
Yeah. And you both, I mean, I work more with Lisa, but Lisa does a great job keeping me in the loop. But always good to just talk about our plans so that we can execute them in the best way possible.
I think it's great that we have so much support to be able to do something like this. The fact that you bring us the resources, and then it isn't just like, oh, here are the resources, see you later. That we have that strong support afterwards. So thank you. And thank you for some input on the vaping proposal.
You're welcome.
Yeah, absolutely. So, what I'll do is I will make sure to provide the slideshow and any attachments or whatever to the tobacco team for a follow-up email that they can send to everybody. So you'll have all the links and then the award guide and our contact information as well. So that's all I have, unless you have any more questions for me. If not, Regan, you can take it away.
Great. See if I can maybe. Okay. Thank you, Kelly, for that. And thank you for the Hill team for joining us. And Heather and Lisa for joining us. And Laura, I see that you logged on as well. So thank you all for being here. And again, we're here to help provide any technical assistance along the way for that. So we will follow up from this session with the recording as well as the slides that Kelly presented and any additional information regarding today's session. And so just a reminder, our next session is January 20th. We're going to be joined by a guest speaker, specifically speaking to supporting students impacted by family substance use. So I think Alyssa's going to drop the flyer in the chat, and if you could download that and share with your school community and anyone that you think would benefit from this conversation or be interested in hearing more about supporting students that are impacted by family substance use. This is open to schools and school community, so feel free to share with parents or any of the staff at your school. And then this is our contact information. And with that, I think we can go ahead and wrap up unless there's any other questions. And again, just expressing our gratitude to you all for being here with us today. And this was our third session of 6 that we have scheduled. And those will go into the first quarter of the new year. And those are on that flyer, so you'll see those. So with that, thank you all. Have a happy and healthy holiday and wonderful start to the new year.
The same to you. Thank you.